Good morning, how are you? Wish you are fine. I want to speak about reparil. Reparil, in general, it is the contents is amorphous acid. Each entry-coated tablet also contains the following excipients: lactose monohydrate, povidone magnesium, citrate, sucrose, talc, acacia, titanium oxide, anhydrous colloidal silica, polyethyl acrylate, metacrylic acid, macrogel 8000, sodium hydroxide, sodium carmelose, tetraethyl citrate, silicone emulsion, carnauba wax, and white beeswax. Acin is derived from horse chestnut. Its action is capillary stabilizing agents, ATC. The thermodynamics. The target site of amorphous acid is the vascular wall. Pathologically, it's raised permeability. Amorphous acid inhibits exudation, but by reducing the extravasation of fluids into the tissue and accelerating the subsidence of edema. The mode of action is based on changes in the permeability of the affected capillary walls. In addition, amorphous acid raises capillary resistance, inhibits inflammatory process, and improves microcirculation. The pharmacokinetics. The metabolism of orally administered amorphous acid was studied in rats and mice. After oral administration of tritium-marked amorphous acid, the administered activity absorbed from the gastrointestinal tract averaged 12 to 16% excretion occurs by both bile and urine. The rate of metabolism and the rate of metabolization is bigger following oral administration than with IV application. The organ distribution of amorphous acid is insignificant in the excretion organs, liver and kidneys, compared to the increased blood levels. According to the indications, reduction of localized swelling following injuries, reparil 20 mg tablets has decongestant effect in case of injuries. The dosage and direction for use: initial dose adults and adolescents over 14 years, 2 to 3 tablets, 2 tablets 3 times a day after meals with some fluid. In milder cases, or as a maintenance dose, 1 tablet 3 times daily. Children between 7 to 14 years, 1 tablet 2 or 3 times daily after meals with some fluid. Treatment should be continued for 2 to 3 months. Administration: reparil 20 mg tablet is taken orally. Overdosage: cases of overdosage haven't been reported. Symptoms after 24 to 48 hours. An overdosage with acid leads to excitation and anxiety, diarrhea and vomiting, mydriasis, delirium, and death due to respiratory paralysis, especially in children. Treatment: elimination of poison, gastric lavage with KMNO4 solution, medicinal charcoal, correction of the water and electrolyte balance, monitoring of renal function, administration of anticonvulsants and antispasmodics. Contraindications: non-hypersensitivity to acid or to any of the excipients of reparil 20 mg tablet, renal insufficiency, renal failure, or kidney disease. Use in pregnancy and lactation. Reparil 20 mg tablets should not be taken during pregnancy because animal studies are insufficient with respect to effects on pregnancy and or embryonal fetal development. Experience with the administration in pregnant women is not documented, since it is known to which extent the active ingredient is passed into breast milk. Breastfeeding should not be done during treatment. Special precautions. Patients suffering from rare hereditary galactose intolerance, lactate deficiency, glucose galactose malabsorption, fructose intolerance, or saccharase isomaltase deficiency should not take reparil 20 milligram tablet because of its contents of lactose and saccharose. In children, reparil 20 milligram tablet is not indicated for children under 7 years old. Use in pregnancy and lactation. Reparil 20 milligram tablet should not be taken during pregnancy because animal studies are insufficient with respect to effects on pregnancy and or embryonal fetal development. Experience with the administration in pregnant women is not documented, since it's unknown to which extent the active ingredient is passed into breast milk. Breastfeeding should not be done during treatment. The side effects. Like all medicines, reparil 20 milligram tablet can have side effects. For the evaluation of undesirable effects, the following terms of frequency are used. Very uncommon. In general, less than 1 of 10 patients, and common 1 of 10 patients, but 1 of 10 patients uncommon, and rare with less than 1 of 1,000 patients, including the isolated rates. In very rare cases, hypersensitivity reactions like urticaria can occur. Disorders of the gastrointestinal tract are uncommon. The countermeasure in case hypersensitivity reaction occur, intake of reparil 20 milligram tablets should be discontinued. Drug interactions. The effects of anticoagulants may be enhanced by ASEN. The concomitant administration of antibiotics of the aminoglycosides type gentamicin should be avoided, since it can be totally be ruled out that the nephrotoxicity may be enhanced. The binding of ASEN to plasma proteins may be affected by antibiotics, cephalotin and ampicillin, which can cause a rise in the concentration of free serum ASEN. The aforementioned substances should therefore not be administered concomitantly to reparil. In general, I used to take 1 tablet or 2 tablets a day. You can take 1 to 2 tablets 3 times a day. It means it can be 6 tablets. It lessens edema. It lessens some of the fluids in the body, and it helps to in the prevention of varicose cells. That's all about the video about reparil gel. If you like the video, please make like, share, subscribe to my YouTube channel. If you didn't like the video, make dislike. If you like it, share it with your friends. Dr. Bassem.